Scientists at the Kenya Medical Research Institute, KEMRI, have been working steadily since the start of the COVID-19 pandemic to come up with locally produced testing kits to help the country fight both coronavirus transmission and the endemic malaria disease. That journey has now borne fruit as Kenya becomes the first country in the region to produce testing kits that are designed with local conditions in mind for both diseases.
We have a kit that is, I would say, stable in such environment, that is accurate, and being a locally produced product, that will be cheaper. And as you mentioned, something that will not require a lot of skills to use. So a health worker, a community health worker somewhere in Western country can open that pouch and do the tests in a very simple and a quick way.
Each year in Kenya, malaria causes about 3.5 million infections and 10,700 fatalities, making it among the leading causes of death in the country. The spread of COVID-19 placed an additional burden on the healthcare system, a situation made worse by the lack of testing kits and vaccines compared to developed countries. The invention of low-cost early detection testing kits for both COVID-19 and malaria will be a game changer for Kenya and Africa, says medical expert Dr. Willis Ahwale.
Diagnosis of any disease is the entry point towards prevention and control. If you are not able to diagnose a disease, you will first not know even what the disease is, and you will not know what measures to put in, and you will not know at what point of control or elimination that you will be at.
The KEMRI inventions will now help the country and the region get better results, says KEMRI team members.
And then we will employ this kit to test whether you have COVID or not. You as the patient, we will give you a negative or positive reaction. But the doctor will give them in much more detail. For example, we'll be able to tell them, we'll be able to tell your physician how much of the virus you have. Is it too much? Is it too low? Are you in the shedding phases? Are you in the beginning stages? So that can also inform the treatment they give you.
The KEMRI, COVID and malaria rapid test kits will save Kenya money, an estimated $32 million or 3.6 billion Kenyan shillings alone for malaria kits that would otherwise have been imported. The money saved will be redirected to other health intervention programs, says Kenya's health ministry, as the country seeks to export this technology to other countries in the continent. Brenda Mulinya for VOA News, Nairobi.